I'm Dr. Shishir Narain. I am the specialist in retina and in uveitis. Uveitis means inflammation of the eye. Okay. Now this is something which is not commonly known to people. They know about appendicitis, they know about gastritis, but they don't know about uveitis. Uveitis उसी को पता है who gets the inflammation of the eye. Once you have the inflammation of the eye and you start hunting for a specialist, then you come to know the term uveitis exists, and then you are all the time chasing and trying to find out what it means. So basically, I am practicing mainly uveitis and also doing a little bit of retina work, and I'm in a group practice where my partners are doing anterior segment surgeries as well as other areas of the eye. In Shroff Eye Centre for last 15 years, that is the place where I have learned a large amount. I have been looking after the imaging department for the first 10 years, and now I am looking after mostly the uveitis patients that are coming over there.
From where you have done your MBBS?
So I basically qualified from University College of Medical Sciences. I am the best medical graduate from 1985 to 1990 batch. I got the gold medal from the Delhi Medical Association. Then I went to do my MS from Guru Nanak Eye Centre, Maulana Azad Medical College. And after that, I was very lucky to first do a research fellowship in Shankar Netralaya, and then followed it up with a uveitis fellowship and then a vitreoretinal fellowship. So I spent 2 years in one of the best institutes of India before I left India, and I went to England for 5 years, where I had higher surgical training as well as a kind of a different aspect of training in United Kingdom for 5 years.
Your father is a well-known eye surgeon. What
Yes,
you
my
say?
father was a
Did
well-known
you
eye.
did you inspire from him, or from where you got the idea to be a
Yes,
surgeon?
since I was 10 or 12 years of age, I have been seeing my father going to camps. Earlier, there used to be a lot of camp surgeries, so I used to go with him. And somewhere, once I sat on his chair, and he said, "Look, mister, you can't sit on this chair. You need to first qualify to sit on this chair." So that was there in my mind right since I was 10 years of age, and I decided I must sit in his chair with qualifications. So, I did pursued the education accordingly, and today I am there in his chair.
How is your system with the double helical?
Double Helical is one of those wonderful magazines that try to approach the common man and try to bring out the best of medical care, whatever is advancement is happening in this field, and also simultaneously identifying people who are giving specialized medical care to the society. So at some point, the big person, Mr. Tiwari, became a friend of mine, and through medical reasons, he identified me amongst the large number of people in the fraternity, and since then, both our personal as well as our medical relationship has grown from strength to strength. So that's my association with Double Helical, and that's a very special association. There are various topics, that one can discuss. CSR. I think we can discuss two common topics of interest. One is age-related macular degeneration, and one is CSR. And the reason why we are talking about these two subjects today is that awareness is required. And if you are aware of this thing, then you can help yourself better by helping the physician who's treating you. So first and foremost, maybe I'll talk about age-related macular degeneration. You see, what happens is that because of the many years of light falling onto the retina and focusing, there is a photic damage to the retinal receptors. So incidentally, I have got a kind of a which I use to actually explain to the patient what is age-related macular degeneration. This is how a normal object should look like. But sometimes what happens is degenerative changes come into the eye, and the quality of your retina changes because of these deposits on the surface underneath the retina. Now, this is what is called dry age-related macular degeneration, and slowly the blood vessels start to grow in it. Till they don't grow in, the image appears straight, but then a kind of a blackness starts to develop and distortion starts to come in. And suddenly, at some point the blood vessels start to grow into it, and this is what is called wet age-related macular degeneration, and you get a big black scotoma in the center. So all it takes actually is to do a home test. It is called the Amsler chart. We ask the patient to look into the center, look for any distortion, and if they see a distortion like this black spot, we'd like them to come to us. The reason is that earlier there was no treatment for it, but now if the patient comes to us in this stage or in early of this stage, we can actually give an injection of anti-VEGF inside the eye, and that can dry it up and save the vision. So basically, it is preventing complete blindness or severe visual loss by a timely injection given inside the eye. So that is what is, and giving nutrients, giving supplements of zeaxanthin and lutein and various other components which are present in the retinal pigment epithelium. It helps to regenerate the epithelium and slow down the degeneration that occurs from age-related macular degeneration. So I think the public needs to know about it, and that is very helpful to prevent or minimize the age-related complications in the retina.
So you mean to say CSR is a serious retinopathy?
Now, CSR, on the other hand, happens in very young people. It happens, the similar symptoms happen. A black spot comes. There is distortion of vision. The objects appear very small, which is called micropsia, and there is collection of fluid, but there is no new vessel formation because the underlying retinal pigment epithelium is healthy. So it is very important to know now there's a lot of advancement in understanding of CSR. It is one of the complications of giving high doses of steroid, and if you are having stress or you are having a very stressful kind of a personality called type A personality, or for any reasons the endogenous steroids in the body are high, you develop a kind of a pachychoroid. That means the choroid itself, this layer becomes thickened and hyperemic. There is more blood flow and there is collection of fluid in the retina. So that then leads to CSR. What is important is that now we have got some treatment for it as well, and some tablets have come out which can be given to patients who are resistant to CSR, and if lifestyle modification and vitamin B supplements are not helping, then there is a solution by giving them specific medication for CSR. So that's what is the latest, I would say, on two of the common conditions that exist.
Is there any particular cause?
For CSR, if you are on steroids, that is a known particular cause for CSR. If you are a smoker or having tobacco in any form, gutka, chalta, anything, then that is a no-no for CSR.
Alcohol also?
Alcohol is not directly known to be related to CSR.
And the symptoms?
Symptoms of CSR again are you start to see a black spot, there is some distortion of vision. Vision becomes blurred, there's a decrease in the acuity, but there's a disturbance in vision. Patients are unable to exactly pinpoint because it happens in one eye. If it happens in both eyes, then patient obviously comes to you very quickly. But if it happens in one eye, patient has disturbed vision, and they do come after about 15 days or a month when that black spot is not going or tends to increase in size.
Whether it is a preventable or curable?
It's not preventable. It can come to anybody. Those with the kind of personality that I explained to you, that can happen. But it definitely is preventable if you decrease the tobacco and if you take the moderation in steroids, or those who have a tendency are not given steroid and we give steroid sparing treatment. Definitely you can minimize the chances of developing CSR.
Treatment of the success rate is what? 50-50 or 40?
Statistically, it is very difficult to say. Luckily, it is one of the better diseases to have. CSR has its own natural courses that it dies out. Now we have identified a small subsection of patients who actually develop the choroidal neovascular membrane. They do develop it. They are more friendly, and giving the injection helps in these patients of CSR. So we have now evolved in our understanding of CSR, we can investigate. We have got something called dye-less angiography. That means you are able to do the angiography of the retina without injecting a dye, and you can look for those very fine new vessels that can come up. So this is called OCTA. The higher form of OCT, the more evolved form of OCT has got OCTA, where you can actually see the blood vessels, and if they are present in a patient of CSR, you can actually give an injection of anti-VEGF. So
if it is left untreated, what will be worse condition?
CSR generally is self-limiting. 6 months, it generally tends to go away. When it doesn't go away, it is called chronic CSR. At that stage, we start giving some new type of diuretics. They are called eplenerone, where they affect the mineralocorticoids. So there's a little bit of a newer, latest kind of medication that is there, and that is reasonably successful, but it should be given under guidance of a physician, because otherwise you can land up with low blood pressure.
As you know, today these are the monsoon season. No? So, do you think there is a precautions about the childs and also adults?
Yes, so now because of the monsoon season, there's a lot of viral conjunctivitis that is going on. A lot of infections are going on. We recommend, if somebody is on an eye drop, not to use, the other person should not share the eye drop. We are also telling all our patients who come with infection to have hygiene, to use sterilium, I examine all my patients of infection with a glove. So because I want to prevent, the spread of infection, so myself I must protect, and then we use a disposable kind of a chin sleeve so that we remove it after we have seen every infected patient, so that we have a fresh slit lamp to examine the patient. So monsoon season, we generally decrease the number of surgeries because of the slightly higher risk of infection post-operatively, and also the kind of viral conjunctivitis that spreads rampantly during this time. So this is, how a CSR is. So such a lot of fluid is there. There is leak, and that happens. And after we have appropriately treated, the whole thing starts to collapse. And this is just after 15 days. So this was on 17/7, and this is on 5/8. So within a period of 2 weeks, the whole of the neurosensory detachment has collapsed, and only a pigment epithelial detachment remains. So this is how, the CSR presents with a black spot. The patient notices this, and after appropriate treatment, the fluid starts to come down tremendously. So this is what is called dye-less angiography. Nowadays, you can study the retina without injecting a dye. Earlier, we used to need to inject a dye. Now we can have the circulation of the eye can be studied even without giving the injection. So here you can see that there is a small area of new vessels that is trying to form here. So this is what is the new thing in ophthalmology, that you can actually study the presence of a small neovascular membrane that can develop. This is the landmark change that has come in this decade, and now you can give an injection of anti-VEGF. In fact, this patient has already received an injection of anti-VEGF, and his CNVM has come under control. Please look up. Kindly look to your right, please. Look down. Look to your left. Please look straight. Yeah. Look up, please. Look to your left. Look down, please. To your right, please. Samne. Sit back. Thank you. Look into the light.
Please look at the center of the green cross and blink freely. Thank you. You can blink freely. Please look at the center of the green cross and blink freely. Thank you. You can blink freely.